So you've got elbow pain. When should you get your elbow pain evaluated? Hello, this is Dr. Siddharth Dambar, expert in regenerative medicine and in rheumatology. Elbow pains can be so painful. When should you get your elbow pain evaluated? So you may have elbow pain either from overusage, maybe a sports injury, or maybe just kind of regular activity around the house and now you've got elbow pain. Or maybe you've got it for no particular activity reason at all. So when should you get your elbow pain checked out? Begin with if your pain is persistent. So let's say you're exercising, you aggravate your elbow, and after you rest for 2-3 days, you're basically kind of back to normal. No problem, probably just amend your activities, be careful, and you're probably okay. But if your pain is persistent, meaning it's not going away after a couple of weeks, probably good to get checked out to make sure you haven't injured something more significantly. Number two, I would say if the pain is more severe, right? If the pain is very mild or moderate, it may be okay just to kind of take it easy, rest, ice, activity modification, see what happens. If it's more severe, that's probably your body's way of saying, look, there's something more wrong here, get that checked out. If you've got swelling, either in the joint or in the tendon, probably worthwhile getting it checked out. If the swelling comes down within a day, maybe not a big deal, but if the swelling is persistent, I would recommend getting that checked out to see if you've done a more significant injury to the elbow. And if you've got a restricted range of motion. So if you've injured the tendon or the bursa, normally that does not limit your normal range of motion in the elbow. But if you've got fluid in the joint or you've injured something within the joint, then there's a restricted range of motion. And by restricted range of motion, what I mean is that you physically cannot move it through the full range of motion. Not just that there's pain preventing you from moving it through the range of motion, but you physically cannot move it through range of motion. And so I would recommend getting checked out if you've got a restricted range of motion. And then lastly, if you've got a persistent functional limitation. If for whatever reason you've got elbow pain and you're still not able to do your normal activities after a week or two, it's worthwhile getting checked out to figure out if you've got a more significant injury, whether that's an injury to the joint, the ligaments, the tendons, the bursa, whatever it is, you should get checked out. So elbow pain, it can be very painful sometimes, especially if the tendons are injured. It can be very painful, surprisingly painful compared to some other kind of injuries. And if it's fairly significant, if it's not going away, I would recommend getting it checked out, figure out what your diagnosis is, and get that treated appropriately. Thank you for your time. Please give us a like, subscribe to the channel. Until we connect again, have a good day and live well. Bye-bye.